Hi, I'm Dr. Sarah, and I'm a urologist. Today we're talking about something many men notice as they get older, but rarely discuss: morning erections. Specifically, why they tend to decrease or disappear after 40, and what that actually means for your health. Let's start with the basics. Morning erections, medically called nocturnal penile tumescence, are a normal part of male physiology. They typically happen during REM sleep. That's the stage of sleep where your brain is most active and you're dreaming. Most men experience 3 to 5 erections during a full night's sleep. Each one can last anywhere from 20 to 40 minutes. The one you notice when you wake up is usually just the last one in that cycle. These erections aren't triggered by sexual thoughts or arousal. They're automatic. They're a sign that your nervous system and blood vessels are functioning properly. Think of them as a maintenance check. Your body is keeping the tissue healthy by bringing oxygen-rich blood into the area. It's similar to how stretching keeps your muscles flexible. So when morning erections happen regularly, it's generally a good sign. It means blood flow is working, nerve signals are intact, hormones are balanced enough to support the process. But here's what I hear all the time in my practice. Men hit their late 30s or early 40s, and they start noticing these erections are less frequent, or less firm, or gone entirely. And that raises the question, is this normal aging or is something wrong? Let's talk about what happens in your body after 40. First, testosterone. This hormone doesn't drop off a cliff at 40, but it does start to decline gradually. We're talking about roughly 1% per year after age 30. By the time you're in your mid-40s, that adds up. Testosterone plays a key role in sexual function, including the quality of nighttime erections. Lower levels don't mean erections stop completely, but they can become less frequent or less rigid. Second, blood vessel health. This is huge. Erections depend on healthy blood flow. As you age, your arteries can become less flexible. Plaque can start to build up, especially if you have risk factors like high cholesterol, high blood pressure, or diabetes. The blood vessels in the penis are small. They're some of the first places where poor circulation shows up. That's why erectile changes are sometimes an early warning sign of cardiovascular issues. Third, sleep quality. REM sleep is where most of these erections happen. But as men age, sleep architecture changes. You might spend less time in deep REM stages. You might wake up more often. Sleep apnea becomes more common. If your sleep is disrupted, your body has fewer opportunities to go through those natural erection cycles. Fourth, lifestyle factors. After 40, life gets more complicated for a lot of men. Work stress increases, physical activity might decrease, weight can creep up, alcohol consumption might be higher. These all affect vascular health and hormone balance. And finally, medications. By your 40s, you're more likely to be on medication for blood pressure, cholesterol, or other conditions. Some of these can interfere with erectile function, including the spontaneous erections that happen at night. So to be clear, a decrease in morning erections after 40 is common. It's not unusual, but it's also not something to completely ignore. Here's what I tell my patients. If morning erections decrease, but you can still achieve erections during sexual activity, and those erections are firm enough for intercourse, then it's likely just a normal part of aging. Your body is still functioning. It's just not as automatic as it used to be. You might need more direct stimulation, you might need to be more intentional about staying healthy, but there's no emergency. However, if morning erections stop completely, and you're also noticing difficulty getting or maintaining erections during sex, that's worth investigating. It could point to a few things: testosterone levels that have dropped more than expected, circulation problems that need attention, blood sugar issues that haven't been diagnosed yet, or even sleep disorders like apnea that are affecting your overall health. Let me give you an example. I had a patient in his mid-40s who came in because he hadn't had a morning erection in over a year. He was worried, but he also said he'd been tired a lot. His wife mentioned he snored heavily. We ran some tests. His testosterone was low normal, but not critically low. His cholesterol was slightly elevated, but the biggest finding was moderate sleep apnea. Once he started using a CPAP machine and made some diet changes, his energy improved. His sleep improved, and within a few months, he started noticing morning erections again. Not every day, but regularly enough that he felt reassured. That's the point. Morning erections are one piece of information. They're a clue, but they're not the whole story. If they decrease, it's a good reason to check in with your overall health. Get blood work done. Make sure your cardiovascular system is in good shape. Look at your sleep. Assess your stress levels, but it's not a reason to panic. So let's talk about what's within your control. First, stay active. Regular exercise improves circulation, supports testosterone production, and helps you sleep better. You don't need to become a marathon runner. 30 minutes of moderate activity most days is enough to make a difference. Walking, swimming, cycling, anything that gets your heart rate up and keeps blood flowing. Second, manage your weight. Excess body fat, especially around the abdomen, is linked to lower testosterone and poorer vascular health. Even losing 5 to 10% of your body weight can improve both. Third, prioritize sleep. Aim for 7 to 8 hours a night. Keep a consistent schedule. If you snore or feel tired during the day despite sleeping enough, talk to your doctor about a sleep study. Fourth, watch your alcohol intake. A drink or two occasionally is fine for most people, but heavy drinking disrupts sleep quality and can lower testosterone over time. Fifth, don't smoke. Smoking damages blood vessels more than almost anything else. If you're a smoker and you're noticing erectile changes, quitting is one of the most powerful things you can do. Sixth, manage chronic conditions. If you have diabetes, high blood pressure, or high cholesterol, work with your doctor to keep them under control. These conditions directly affect the blood vessels that erections depend on. And seventh, talk to your doctor about your medications. If you started a new medication around the time your morning erections decreased, it's worth asking if there's a connection. Sometimes a different dose or a different drug can make a difference. Now, I also want to mention testosterone. If you're experiencing other symptoms along with the loss of morning erections, like low energy, mood changes, difficulty concentrating, or reduced muscle mass, it's worth getting your testosterone checked. But here's the thing, testosterone replacement isn't a magic fix. It's not appropriate for everyone, and it comes with risks and side effects that need to be carefully considered. If your testosterone is low, there are often lifestyle factors contributing to that. Addressing those first is usually the best approach. Let's talk about when this becomes something you should bring to a doctor sooner rather than later. If morning erections stop suddenly, not gradually, that's worth checking out. A sudden change can sometimes indicate a medical issue that needs attention. If you're under 40 and you've noticed a significant drop or complete absence of morning erections, that's also worth investigating. It's less likely to be simple aging at that point. If you're having trouble with erections during sexual activity as well, not just in the morning, see a doctor. That's a sign that the issue is broader than just nighttime physiology. If you have other symptoms, fatigue that doesn't improve with rest, mood changes, weight gain that's hard to explain, pain or discomfort in the pelvic area, these can all point to underlying issues that need evaluation. And if you have known risk factors for cardiovascular disease, like a family history of heart problems, diabetes, or high cholesterol, and you're noticing erectile changes, bring it up. Erectile function is closely tied to heart health. Your doctor will likely start with a conversation. They'll ask about your medical history, your lifestyle, and your symptoms. They'll probably order some blood work to check testosterone, blood sugar, cholesterol, and other markers. Depending on what they find, they might refer you to a urologist or an endocrinologist for further evaluation. The key is not to avoid the conversation because you feel embarrassed. This is a common issue. Doctors deal with it every day. There's no judgment, it's just part of taking care of your health. Here's what I want you to take away from this. Morning erections are a useful indicator of your overall health. They're not the only indicator, but they're one piece of the puzzle. A decrease after 40 is normal for many men. It doesn't automatically mean something is wrong, but it's also not something to completely brush off. Your body is giving you information. It's telling you that things are changing. And the best response is to pay attention. Get a checkup. Make sure the basics are in good shape. Blood pressure, cholesterol, blood sugar, testosterone. Stay active, eat well, sleep well, manage stress. These aren't just generic health tips. They directly affect the systems that support erectile function. And if something does need to be addressed, catching it early is always better. Whether it's a circulation issue, a hormone imbalance, or a sleep disorder, early intervention gives you more options and better outcomes. So don't ignore the message your body is sending, but also don't catastrophize. Most of the time, small changes make a big difference. All right, that's what I wanted to share with you today. If you found this helpful, I'd appreciate it if you'd leave a comment. Let me know if you have questions or if there are other topics you'd like me to cover. Thanks for watching and take care of yourself.